All right, we are live. Awesome. Well, welcome. My name is Bjorn, and I'm going to do a presentation on traumatic brain injury, TBI, and the treatment that I went through after I had that. So make sure everything is set up correctly here. Let me get the right slide so we can all see the same thing. Hopefully, you should see now my PowerPoint presentation that I have. What I'm going to do, I'm going to do 3 slides about TBI, traumatic brain injury. And then I'm going to go into some treatments and videos of some other people that have recovered using the treatment that I went through. And then I'm talk a little bit more specifically about my story, how I went through the treatment and how I recovered. I'm not 100% yet, but I'm getting there. And it's just I'm way better than what I was. I'll show you some pictures of what I look like. So I was pretty messed up. And so, anyways, I hope everyone can see it. Hope it's working out. Had some issues with the microphone last time I did this, but I will, yeah, let's just get going. So you can find all the information on bjornbrain.com. It's my website where I have all the info that I put out there. I put it there, and I share a lot of stuff on YouTube and Facebook, different places to get the word out because there's so many people that have had a knock to the head, or just traumatic brain injuries. It can be through inflammation, a million different things, and we just need people need to know there is hope. There are ways to recover, and this is the best technology that's been developed as of now to restore the function of the brain. So, traumatic brain injury, the injury you can't always see. So, TBI happens when a bump, blow, or jolt to the head disrupts the normal brain function. It can be caused by accidents, falls, sports injuries, or even whiplash. The damage isn't always visible, yet the effects can last for months or years. Sometimes it takes years for the injury, for the body to be not be able to handle it, and the symptoms get really, really bad. And that's what it did with me. I had a really bad whiplash. I also had a bunch of concussions, had injuries, and it took years before my body was like freaking out, and it was just too much stuff going on, and I just couldn't handle it anymore. And that's why, so people have had a whiplash. For me, it took 15 years before the symptoms of that got severe. And then concussions, what they say is that when you knock your head, like the brain is just kind of mushy. So if you hit your head, the brain is kind of squashed into that area, and then when on the way back, it will get like smashed into the other side. So you can have two separate injuries in the brain, and it's just really complicated, and that can affect the brain waves in the brain, the patterns. And when it does that, you can have some really weird neurological symptoms that people just don't understand. And you go to the doctor, and doctor's like, "Well, I don't see an injury. Your MRI is fine. Structurally, you're okay." But in here, the brain waves, the patterns have been disrupted, and that's creating weird neurological symptoms. Like for me, it's really bad light sensitivity, couldn't see anything, couldn't hear, whole body was shaking, just in a state of panic 24/7. It was really, really bad. Um, Next, life after TBI. So it's the invisible battle because, again, people, the doctors, they're like, no, you're fine. There's nothing wrong with you. So brain fog, memory problems, chronic fatigue, and poor focus, headaches, migraines, dizziness, sensitivity to light and sound, which I had, mood swings, anxiety, depression, tell me about it, sleep issues, and emotional numbness, balance problems, or difficulty thinking clearly. Many are told they look fine while still struggling inside. Standard tests often miss the deeper brain dysfunction. So that is what they have now mapped out. They know exactly how the brain's functioning now. So they can restore the function of the brain with this type of treatment that I'm going to show you guys today. Why TBI is so difficult? Well, most treatments focus on coping, not healing. Many are told to rest, take medication, or wait out, but the time alone doesn't rewire the brain. What happens is that when the brain waves have been changed, and you okay, let's do this. Okay, my shoulders like this. Let's say I have a knock to my shoulder's tight. I walk around like this for years. Now the brain is now going to think that this is normal. Okay, but this is not normal. So if I walk around like this, even though you can see visually, okay, yeah, this is not normal, but my brain now thinks it's normal. So I need to retrain it by getting my shoulder back down again and retraining the brain that this is not normal, but this is normal. And once you do that, you're rewiring your brain again back to normal. But if you walk around like that for a long time, the brain thinks it's normal. And it's not going to just go back to its regular state unless you nudge it, help it a little bit to teach it this is normal. And that's the problem. You can't expect a brain that has been miswired or misfiring to just suddenly go back to normal. Like it just doesn't work. Like it doesn't know that because it thinks that this is normal. Like it's adapting to that. So, anyways, TBI disrupts how the brain communicates within itself. To truly recover, you have to retrain the brain's connections. So, I'm going to show this is a girl. She's 16 years old and she had a traumatic brain injury. And you can let's just go through this real quick and then I'll talk more about it later. So you can see the eyes. So her brain is not going to go back to normal just by taking medication, flooding the brain with chemicals, or just not doing anything. As you can see, her eyes are all messed up. And after 6 weeks of intensive treatment in IFN, she's back to normal life. Look at that smile. She's back to normal. Amazing. This is a girl. She didn't have TBI, but she had really bad seizures, over 100 seizures a day. Okay, very, very serious. So that's her first QEEG. Within a week, her seizure rate dropped by 90%. Okay, it's amazing. It's just amazing. This is RH. She's age 12, can't walk, from a bicycle accident and a mild concussion. And they're saying, the doctors are like, oh, he just wants attention. I mean, so many of us, this is the information we get. Like the doctors don't know anything. Okay, they really don't know anything about this. After 6 months of care, he's walking by himself, and after I think it's 12 months, then he's 9 months of care, he's walking by himself. Look at that, amazing, right? Took 9 months, but a mild concussion made him not able to walk. Doctor said he was just wanting attention. Okay, this is Sam, severe neck injury while on the beach. He's paraplegic, very, very serious. And told he had less than 1% chance of regaining any movement. So after 6 weeks of intensive, look, he's moving his leg. This is after 6 weeks, 12 months of treatment with IFN. He's now walking aided. And now he's dancing his way to recovery. And he's just going to get better and better. And they're restoring the function through his neck, to the brain. Now he's walking unaided against all odds. I'm telling you, it's a miracle. This type of treatment makes total sense. This is ADHD, dyslexia, but that was not his issue. Okay, that's just a label doctors give, and just had a lot of issues. But then IFN identified it as sensory confusion with the eyes. You see, the eyes are going back and forth, not able to focus. That was his challenge, not ADHD. So they resolved that by restoring the function of the brain, and now he no longer suffers with any of these things. It's just amazing. Back to living a normal life. So all these people, they have had they're not all had head hits to the head. You saw, like, at least there was two there, one with mild concussion, the other one with the TBI from a head injury from a car accident. But basically their wiring in their brain was miswired or misfiring. And once you restore the function of the brain, the symptoms usually go away. So this area might no longer be talking to this area. This area might not be talking to this area. Or there's so much noise, every part of the brain is screaming, trying to get their attention, and that creates so much noise, so the brain is not able to focus properly, and your eyes are going everywhere, and your light sensitivity, sound sensitivity, and you're just freaking out. So let's just go through. I'm going to go through some slides. This is let me see. There we go. You can find all this information on bjornbrain.com if you want to read about it instead. This later, I'm not a doctor. I share from a patient point of view. And so just make sure you talk to your doctor about this. The treatment that I just showed you is from IFN, Dr. Randy Beck. They're out of Australia, but home treatment is available over video call. And that's why I tell everyone about it, because you can be treated at home. I spent $250,000 traveling around the world to the best doctors in the world. And one, they didn't help me. Two, I spent just a ton of money. But now you can literally sit at home. You put the pads on yourself, and they tell you where to put it, how to do it. It's amazing the stuff they can do now. So use promo code Bjorn, and you get a discount on your first treatment. It helps my mission to share this with everybody. This is the state that I was in. I was pretty messed up. I'm telling you. We tried everything. Like, we traveled all over the world, and yeah, it was bad. It was very serious. Light sensitivity, sound sensitivity, the brain stuck in a state of panic. So I would sit there just freaking out 24/7. Like, I don't know if you've ever been stuck in a panic attack, but like, if a tiger is chasing you, you're supposed to freak out and run, because you need to run away. So you can activate the fight or flight responses. But that's only for a few seconds. I was in that state 24/7, and it was awful. Okay. Just beyond awful. Nobody should have to go through that kind of crap. Okay. Then So the symptoms that people often have for miswiring in the brain: depression, fear, anxiety, addiction, any phobia, dyslexia, panic attacks, migraine, irritability, fatigue, sleep difficulties, mood swings. Anyways, all these different symptoms: traumatic brain injury, long COVID, stroke recovery, epilepsy. All these different symptoms are what there's a wiring in the brain that is not going the way it's supposed to, and that's what needs to be changed. I'm telling you, doctors don't know anything. They just label you. They say, this is what's going on with you," but they have no idea. Then they just drug you, like they did with me. They just gave me medication and said, "Hey, you're crazy. Here's some medication. Good luck." You know, that's it. They don't know what to do. They have no idea, and there's no incentive to like help you either. Like there's so much technology that's been developed, like this kind of treatment, but they just don't know about it because they're what's the incentive for them? For them, they make money by pushing pills, and that's how they get paid. So another thing with me was my stomach was just really bad shape. Like my stomach was hurting like crazy, and I couldn't eat anything. It was just awful. And what I knew is that when you have had a whiplash or I had an issue with C1, they'd never seen somebody with that kind of issues before. It was totally off. And because of that, the vagus nerve was being pinched, and it was leading to severe stomach issues. So if I went to when I went to the doctor, they're like, "Hey, to here a bunch of antacids to take that," and I'm like, "Well, I took that, but it never dealt with the root issue." So you can take that dealing with antiacids for the stomach, but if you're not dealing with the neck, you're not dealing with the root issue. So the vagus nerve is one of the cranial nerves and it goes through the neck. So the whiplash that I had was putting pressure, massive pressure on the vagus nerve, making me freak out. And it can cause heart rate issues, digestion. You look at all these: breathing, voice, inflammatory response, mood, and anxiety. So what you got to understand is that you go to doctor for any of these symptoms, and they're going to give you pills, but they're not going to treat the neck because they don't know that's the issue. And that's the key. You got to find a place who can treat these different things as well. So the C1 atlas, very, very important. Vagus nerve. Oh man, my stomach was so bloated. I could not. It was awful. Lyme disease as well. Diagnosis with bacterial infection. You can read more about it on there, but it's very, very serious. So I had a combination of different things, and I tried neurofeedback, lens, TMS, bioresonance therapy, light laser therapy, and I regret doing the red light and laser therapy because they did it all over my brain. They didn't use precision, which is very, very important. And when you treat the whole brain, you're treating areas that don't need treatment. So, and that's the problem. Same thing with a lot of these different therapies, like with chemicals, you take pills and they treat, you flood the entire brain with chemicals. And of course, you're going to have some issues after that because the good areas, the areas that are functioning are being treated, are getting those chemicals as well. You can't just, use precision with chemicals like that. You flood the entire brain with it. And when you do that, you have all these different symptoms, which are usually sometimes worse than when you started, what you came in for. Anyways, hyperthermia, the heat of my body to 42.6 degrees, hypnosis, medication. I haven't tried everything, but I've tried most of the therapies that are out there and that people do. So if you have any questions and specifically that you're wondering about, let me know. So now I can see without sunglasses. I'm not blindfolded anymore. I'm getting better, still getting better. So, anyways, a lot of this started with Dr. Carrick, who's developed these really amazing brain hacks um, that our doctor told us about. And he said, in this picture, you can see they're holding a mirror and they're hacking the brain. So the boy has a head injury and his left arm is not working from a concussion. So he is lifting his right arm, but his brain is looking in the mirror and the brain thinks that he's lifting his right arm. So by doing no, no, sorry, lifting his left arm. So now the guy's like, oh, the brain is like, okay, oh, that's normal. I can lift it. And that's how they established a connection in the part of the brain to be able to get him hack his brain to be like, you know what, you can lift your left arm. So, anyways, these type of brain hacks have been developed for decades. Dr. Carrick is not the only one who did that, but so the doctor that I go to, Dr. Beck, he worked there for 10 years and learned all these techniques. But then Dr. Beck wanted to get into QEEG scans and also tDCS, which I'll tell him more about later. So he left that and started his own practice. And he's using a combination of the new cutting edge technologies together with these old school brain hacks that have been around forever. So you get the best of the best, and that is why. So Carrick, Dr. Carrick doesn't take patients anymore, um, and that's why we went to Dr. Beck. How we heard of Dr. Beck. So these are a QEEG brain map and you can see they do these scans. Okay, so this is just a scan, and you get the different colors of the brain, and you can see what areas are working properly and what areas are not working properly. So they compare your scan to millions of other scans, or at least depending on which sample, probably hundreds of thousands of other samples of people that don't have your symptoms. And they say, okay, well, these people don't have your symptoms, so we're going to tweak your brain to bring it back to what all these other people have who don't have your symptoms. And we're going to watch, see what happened to your symptoms. That's all they do. Okay. They tweak your brain using laser, using electricity to restore that function. So you or me, we become more normal. Okay. So if let's this is a normal range, I was way out there. Then they want to bring you back to normal where your brain is functioning. And then you can do a lot of other therapies and get well. But I couldn't do anything else because I was so far out there. So they got neurofeedback, which is very, very popular. I think in this image, they're using neurofeedback right here. But it works for people if you're in the normal range. But if you're outside of that, like I was, just it doesn't work. So on the brain map, a doctor who looks at it can see, okay, blue, that is too little activity. Red is too much activity. We want green, okay? You want green, but nobody has green all over. I mean, some people probably do, but you want as much green as possible. And that's basically how it works. And Dr. Beck's got proprietary software so he can analyze and find out specifically what else is going on in your brain. And then he develops his plan based on the QEEG map, okay? And he's the only one, he's the best one in the world. Other people do it, but he's the best one in the world because he's been doing it the longest. And he combines it with these old school brain hacks. So he doesn't just do this, he combines it with the really unique exercises to get the brain functioning. So it's amazing. It's just amazing. So this is Dr. Beck right here. Home treatment available, video call. I'm telling you, to be able to be treated at home. Oh, do you know how much it costs to live in California in a hotel for 3 months? I mean, it's expensive. Germany, Canada, I've been everywhere. So you get a discount, use Bjorn promo code. And yeah, so Dr. Beck combines tDCS with multiple therapies. And the neuroplasticity, this is from one of his presentations. Neuroplasticity is the brain's incredible ability to reorganize itself by forming new neural connections as it changes in response to stimuli. Its ability to adapt to the environment. So the brain is plastic. It can change. You're not hardwired. If you're hardwired, which a lot of doctors think, you can't change the brain. But because the brain is plastic, right? You can bend, they can move things. And that is just, oh, it's so wonderful. So Dr. Beck, he's the best, the best. Everyone for the hardest cases go to him because he's just known to be the best. And so if you're going to deal with your brain controls everything. You want to go to the best, and Dr. Beck is the best. All right, so tDCS, what is it? Transcranial direct current stimulation. It's just these pads you put on that send a little bit of electricity. You can see in the picture right here. That's what it looks like. Got a pad here, a pad there, and a little bit of electricity that's going through your brain. So tDCS is an emerging neuromodulation technique that provides a safe, low-cost, non-invasive means of modulating the brain. So it's not shock therapy, okay? People freak out sometimes. They're like, oh, it's just shock therapy. No, it's not shock therapy. And it just works. You put it on for 10 minutes. You feel a little bit of tingling sometimes if the pads are not wet with saline, and then it just sends a small amount through. So you're restoring that function. Then they might change it for the next series of treatments you do from here to here, maybe whatever areas to get the brain functioning. And once you get those parts functioning again, they're not other parts of the brain will not be overcompensating and that creating all these issues. So the brain will just start normalizing, and you'll process the world the way process everything the way you're supposed to process it. You're not processing it things incorrectly. So that's that. So tDCS has been used for decades. It's not like something new that Dr. Beck came up with. Here, this is an article how DARPA hacked a science writer's brain and turned her into a sharpshooter. So this lady went through this. She didn't know how to shoot, but after using this device with the device on her head, delivering electrical currents, AED went from a frustrated shooter to a skilled sniper. Isn't that amazing? So that's how they treat their soldiers to be able to do these things. I mean, it's just so it's been around, and you can buy these online and do it yourself, but you're only going to mess yourself up because you don't know what you're doing. I don't know what I'm doing, but you got to have the best doctor in the world treat you if you're going to do this because you don't want to put this on yourself and just get messed up. Okay, not cool, not cool. Be very, very careful. I know people have done that. They bought it and they get worse. Then they go to Dr. Beck and they're like, okay, he's got to bring them back to where they were before he can actually start a real treatment. It's just, it's shocking the stuff that people do. But if you don't know any better, you're desperate, you're trying all kinds of stuff. Well, of course you're going to try that. But I'm telling you, you gotta have a you gotta have Dr. Beck oversee it. Okay, it's very everything. You mess up the brain, and it messes with everything in the body. Okay. Okay, so transcranial direct current stimulation is a non-invasive, painless brain stimulation treatment that uses direct electrical currents to stimulate specific parts of the brain. So it's using precision. You're going to specific areas. You're not flooding the entire brain. You're not treating the whole brain. I did laser and red light therapy, and they over an entire brain. I didn't need that. You only want to go to specific areas that need it, and that's what is key with tDCS. It's very specific, so you go specifically to the areas that need it. And in the video that I showed earlier of the guy with the neck injury, they use spine DC on the spine as well. They did that with me as well. So if you have a neck injury, they can do that as well. Send electricity up and down the spine, connect the brain to the body again through the neck, and then they can start treating the brain. But they can do that as well. This is a brain map of somebody with ADHD, very specific markers. You see the blue right there. Instantly, they can look at a brain map and be like, okay, this person most likely have symptoms of ADHD. And once you see that, then you're like, okay, well, we're going to do something about it. And they can tweak it and bring these areas that are blue, bring them back to green. And those areas that are red, bring those back to green as well. So they have, it's amazing. It's really amazing. We'll have that able to do that. All right. So Institute of Functional Neuroscience, Dr. Peck, give him a call, set up an appointment, send me a message if you have any questions. Use promo code Bjorn, you get a discount. All the information that I shared now is on my website, bjornbrain.com as well. Let me go back here. Let me go my website. Can you guys see my website now? Hopefully you guys can see my website. So this is my website, and I have all the information here that I've posted as well. I have videos, everything's here. If you go to case studies right here, you can read a lot of case studies about other people that have been treated. Stories, case studies, like really good case studies of like autism, bipolar disorder, chronic headaches, depression, all kinds of stuff. And you can contact me here if you have any questions. And there's an FAQ here where I've tried to answer as many questions as possible. So just go to my website, check it out. Let's see if there's any questions. I had a question yesterday. Let me find it real quick that somebody asked me. 1 second. See if I can find it. Okay, here we go. Okay, so the reason I did this was the question was, how can tDCS benefit someone with a traumatic brain injury, TBI? Well, that's what we kind of went through that's why I decided to do TBI today, because that's what people have issues with, traumatic brain injury. So it's an invisible injury, an injury you can't see structurally. They can do an MRI scan. They don't see anything. They're going to tell you you're fine. The doctors just, they don't know. They're going to give you a bunch of pills. So with that, you need to find somebody that can do a brain scan like I showed you with that says, okay, what is going on in my brain using the QEG scan? Because that's not an MRI. Let me go back to that slide. Let me open this again. So in regards to the question, how can tDCS benefit someone with a traumatic brain injury, TBI? Well, MRIs will not be able to detect this. CT scans will not be able to detect any structural damage, which is why you need to do a QEG scan to figure out exactly what's going on in the brain, how the brain is talking, how it's functioning, communicating. And if there's tons of noise in your brain, then you want to change that. You want whatever parts of the brain are overcompensating for areas that are damaged, you want to tweak that. If you have issues here or there, that's creating an issue with your vision, whatever it might be, you want to tweak that and bring it back to normal. And most doctors don't know how to do that. They just look at it and say, well, structurally, it's fine. It's all in your head, whatever. But now you can go in with precision tDCS and you can rewire the brain and bring it back to normal after a TBI or traumatic brain injury. So it is possible, but only a few doctors in the world know how to do it. But at least it is possible, right? So every 18 sessions, you do another brain scan to see the differences. The colors will change. You'll be like, whoa, I'm getting better. You'll feel better. You'll look at the pictures and you're like, oh, I'm getting better. It's amazing. Okay. So if you have traumatic brain injury, TBI, it is possible. Please check out the videos I sent you or showed earlier. People are recovering. People are getting well. Okay. You don't have to live with these symptoms. There is hope. Okay. So hang in there. And if you guys have any questions, go to my website, send me an email. or contact Dr. Beck, and you gotta try it out, man. You gotta get well. And I know it's not easy if you're feeling discouraged, if you're feeling down. Hang in there. It's rough. You saw the pictures of me. It was just, it was brutal. And the worst thing is when you go to these doctors and they all say they can help you, but they really don't know what they're doing. That's the most discouraging thing, I think, is you go through all these treatments, spend hundreds of thousands of dollars, and you don't get any better. Anyway, so I've gone to all the best ones. This Dr. Beck is the best. He writes the manuals for how to do this kind of stuff. He is the best in the world for this kind of stuff. So if you have TBI, at least contact them, check it out. And again, I'm not a doctor, so from a patient point of view, all the technical stuff or like from got to talk to Dr. Beck about. He'll explain all that kind of stuff because I can't do it. But I just share from a patient point of view. Again, I've been so many places, $250,000. You can read my story here. Um, yeah, just trying to survive blindfolded for years in our apartment. Everything in our apartment was completely blacked out. Couldn't see anything. It was bad. Okay, cool. So be encouraged. There's hope now. If you know of anybody with TBI, send this to them and so they can recover as well. All right. Thank you so much for listening. I really appreciate it. Again, this is my website. And let me see if I have the links here. Okay, I just have my email. I have to post the other links that I have that you can contact me too. But if you have TBI, I'm telling you, it is possible to recover. So hang in there. Send me an email if you have any questions, and we'll go from there. All right, take care, everyone. Bye bye.